Hello, I am Dr. Isaac Samuel. I'm a surgeon in the United States of America. I work as a faculty surgeon at the University of Iowa, about 3 hours away from Chicago. And I do a lot of minimally invasive surgery, which is also called laparoscopic surgery or keyhole surgery, where we make small keyhole incisions into the patient's abdomen and put in a camera, and I watch the surgery on a monitor and do all the surgery through instruments through these keyhole incisions. For this, sometimes I have to extend my neck like this and lift up my arm like this to do my surgery, and in some patients I have to struggle a lot, and that gave me an acute attack of a pinched nerve, also called radiculopathy. So this pinched nerve in March of 2013 caused me such severe pain that I could not operate for several weeks, and it took about 2 months to recover. I went and saw an orthopedic surgeon. I also saw a neurosurgeon, and they gave me a steroid injection into the nerve sheath. But with all this, I was still in pain for 2 to 3 months. And only after 3 months, for the first time, I could start operating on my own again, and I could take a plane and travel outside. And then things settled for a while, and then in December 2013, suddenly I was doing another surgery, which was a difficult surgery, and the same thing happened again, and it was a acute pain. And this happened the week before I was traveling to India on vacation. So when I told my mother about it, she mentioned that she had cervical spine problem and also a lower back problem, for which she saw Dr. Joseph John, and she was able to get complete relief of her problems, and she advised me strongly to consider this treatment. So 1 week ago, I met Dr. Joseph John in his clinic, and he took my history and MRI result and everything, and he felt that if he improves the alignment of my vertebrae, he can increase the space that is required for the nerve root to come out, and that would relieve the pain. So he gave me a treatment where he laid me flat on the ground and aligned my spine, and following that he gave me oil massage treatment along with application of medications here. But after the first day, 95% of my pain went away. Before that, I could not turn to my right. Driving was very difficult, especially on the bumpy Indian roads. Just driving would give me pain here. And if I reached for my seat belt, that would give me pain. So if I lifted my arm like this and turned my neck to go for the seat belt, I could not do that because of severe pain. I had to do this to reach it. But after the first day of treatment, I was amazed. Next morning when I drove back for my next oil massage, I could look back, catch the seat belt and pull it down and put it in. I could not do that before without pain. So 95% of my pain went away after the first alignment treatment, and following that I'm doing several days of oil massage along with medications applied to my shoulder, and the pain is going away. Even the muscle pain that I had in my shoulder and scapular area, all that pain is going away. And right now, after 1 week of treatment, I'm really completely pain-free now. But I'm going to complete the treatment. And for the long run, I'm going to be a little more careful when I operate. But if I ever have the problem again, I'm going to come back for another treatment. But even if I'm okay, every year I plan to come for a checkup and alignment. I'm very pleased with the result. Thank you, Dr. Joseph.
Okay, thank you.